Good morning and welcome to the weekly blog. My name is Dr. David Hutchings, and these are being sponsored by SpectraMed. One of the things I wanted to discuss, I'm seeing with a lot of my patients right now, is an area that I think we often overlook, and it's the area of weight loss. Right now, especially with patients being in quarantine, if they're in a facility-based or community-based setting, is a detrimental. I'm seeing this every single day, guys, where it's just detrimental on the patients and also the caregivers. So whether they have dementia or whatever the diagnosis may be, this is a drastic change in their environment and also a drastic change in their ability to have social interaction with other people. So we do see changes in behaviors, and some of that also includes changes in intake. So one of the things I really wanted to highlight this morning, because I'm seeing this across the board with several patients of mine right now, is weight loss. And that obviously impacts their skin integrity, their hydration, their strength. It increases their chance of developing other infections and respiratory infections. So one of the things we got to look at too is what is the etiology of the weight loss itself? So what's causing this? Is it something neurological? Is there something going on with the swallowing? Is it behavioral? So you have to figure out exactly what is causing the weight loss, and then develop a plan around ways to increase intake. And sometimes we got to be very, very creative to do this. So one of the things I think that we kind of miss is we all look at trying how can we build our caseloads, what are we missing within our facilities, and weight loss is certainly one of the biggest ones that I'm seeing right now. I had two patients yesterday and actually four over the past 2 weeks that have had a little bit of weight loss that caused dentures not to fit, and now they're not using dentures at all, and the patients are not eating at all. And so that has caused issues not only with intake, weight loss, skin integrity, changes in face structure, but also not taking their medications as well. So weight loss is something that I suggest that every one of you should be looking at within your facilities to say, okay, I know a lot of facilities have weight loss reports. Even if it's not a massive weight loss, even if it's 3 pounds, we should be looking at these patients immediately to be able to prevent more weight loss. And at that point, we're just trying to play catch up at that point. So my suggestion is if anything, a patient's losing 3 pounds from the last report, then they should at least be screened and looked at to figure out what the etiology of the weight loss is. So we really look at a lot of things when it comes to a variety of different diagnoses, and we also treat a lot of different areas, but this is one symptom I think that we miss a lot of times. Plus, it's something that can benefit the facility. And I know a lot of things on star ratings and those types of things. And weight loss obviously increases chances of hospitalization, but also increases chances of, again, wound development, hydration issues, other infections, and also pneumonia. So definitely let's start looking at weight loss quite a bit more. I know I am. It's something I don't necessarily always think about as much as I should. And sometimes we always need that little refresher. So thank you, and we'll see you again next week.